Hi, Dr. Coffman. How are you today?
I'm great, Allison. How you doing?
Good. So, I want to start by saying, whether you care or not, that one of my favorite all time movies is The Breakfast Club.
Oh,
I've always loved that. John Hughes. Okay. Yeah.
yes.
Yeah. this is iconic.
Yeah,
Thanks to Pitch Perfect for the new,
that's
new
right. Yeah,
generation, right? Um, and I can't help but wonder. I've seen that movie a million times. I can quote almost every line, but it always leaves me in a little bit of sorrow because number one, they leave, and we never get to find out what happens after they leave, right? Because they had been kind of self quarantine, for lack of a better word, together. It's funny, but I now know what happens after that movie because my family and I have been like and I think yours have too, right? We have been like this sort of figurative breakfast club or literal breakfast club for like 9 or 10 weeks and all quarantine. And slowly our little posse is moving away from each other, right? So we lost, I guess the alternative guy, the musician guy. Our oldest son left. He's out in Montana now for the summer, which I'm thankful because a very low rate of corona out there. My
yes.
husband has now left his back bedroom home office to go to his real office, and there's only a dozen or so people in the building, and he's sort of self quarantined there. So now it's down to me and two other boys. I'm like, no, don't go. Don't. It's sort of like, the blessing and the curse of being together for so long. But I don't know, is that happening with your family? Like, do you find yourself getting so used to being together all the time that the letting
Mhm.
go is not just, it's a little sad, right? It's bittersweet.
It is. Well, my oldest peeled off this week, and one of her friends has been quarantined, and they went to the beach with their family. So we're down to four now, and it seems like every day you start that process, and then every day is a new negotiation as you go along. But the funny thing with Breakfast Club is I built that up. That was one of our early quarantine movies that the kids had never seen, and I built Ali Sheedy up too much as my high school crush. And my girls were worried, like, that's what you were interested in high school. Yeah. And the other question was that, like, did everyone look like they were 35 when you were in
Right.
college?
Right. Judd Nelson, that he could
Yeah.
pass for a high school student back then, and we didn't even question it. I'm like,
Yeah.
okay, yeah, sure. Oh gosh, that whole era, right? And it's also part of this nostalgia that we're feeling.
Hmm.
I know you saw the news this week, as did all of the country, where we're usually so proud of Chattanooga hitting the top 10 list of any list, but especially when it happens in the New York Times. But
Right.
unfortunately, the top 10 list we hit this week was not a coveted one. It is the sense that there are certain cities across the U.S. where they're anticipating larger flare-ups of the virus based on current numbers. Chattanooga was top 10, Dalton was top 10, I think Cookeville, Tennessee, our surrounding areas. What did that say to you when you noticed those numbers, and what should it say to us as we continue to further, socialize after social distancing? We're
Mhm.
still wearing masks, but it just feels like, is it all too soon? Are we not gradually doing what we should be, instead rushing to it?
Yeah, and it is a lot of what I'm hearing, both from my kids and from people that I hang out with, that I'm seeing at work and in the community, is just this sense of what is going on, because I'm hearing so many different things and I'm seeing so many different things. And a lot of people went to the beach over Memorial Weekend, or went out, to Gatlinburg and other places, and there was just this sense of kind of this explosion. People have been kind of cooped up, and some denial, some, just some people need it, and I think it's going to be interesting to see how that plays out. We've been loosening what we're doing over the last couple of weeks. Some of it is that I think the locally we're having a pretty big growth amongst food workers. So we had a chicken plant where there was 11 of the employees that got sick. There was a farm group in Ray County where they had a big outbreak, and then some of that is what's happening in Dalton as well. And I think it really speaks to there's a lot of people that have been going to work every day to make sure we can
Right.
eat. And those people, we owe them a huge debt of gratitude because they're fearless and they've been taking care of their families, trying to get paid, and they're doing the work that we have to have in order to have food to eat and have ways to feed our families. And what we're seeing right now is, there's it's difficult because the lack of guidance in the workplace on how a lot of the food production companies were exempt from initial guidance and initial restrictions, and so we're seeing workers were put in bad situations. And then I think it also really speaks to some of the health disparities that we have in our community. I think the good news is we're responding. The testing rates have gone up dramatically locally. I've been quite disappointed because our testing has not been that great in Tennessee, and then Tennessee has actually been like we're better than the rest of the Southeast, which is one of those things where you're like, great, but we're still, as folks are watching the data, when you're seeing the positive number of tests, that if you're doing good testing, that should be hovering around 2%, and we're still hanging out anywhere from 4.5 to 7%, depending on how you slice the numbers. So we're not doing enough testing. Although I think we're seeing in Hamilton County specifically that is the health department's getting better at how they do it. They've started expanding their testing sites, so all that's encouraging. I think we're looking at 151 new cases over the weekend, which is very disappointing. You would like to see that things stayed flat as we opened up, and that's just not happening. The other thing that concerns me is that the way these are going to play out is that typically people will get symptomatic about 5 days into the illness. So once you contract coronavirus, it can range from 2 to 14 days, but typically it's around 5 days. People tend to get sick enough that they have to be hospitalized at around 14 days. And then people get so sick that they have to be in critical care or pass away in the third to fourth week. And so we're starting to see an uptick in deaths. So we had 2 in the last week, which would suggest that there's a lot of people in the pipeline who have gotten it. Um, if you look at the active cases, we're at 328 yesterday. Which extrapolates kind of what data you use. Around 1 in 10 to 1 in 30 people in our community have it. So we're just seeing that the amount of people that are the amount of people that are carrying it right now is really going up. And so as you're trying to figure out what we do as a family, how many people do we hang out with, where do we go, the odds that you're going to experience people that are shedding the virus who have it and are able to spread it in their saliva and their sneezing and that kind of thing is going up.
Yeah. So I keep seeing data, and this is my fault because I keep consuming information, even though I know you tell me that there is also a healthy way to consume information and to process it. And I'm trying to do that, but it is also hard not to go on social media and not to start clicking on, the different articles people are sharing. And part of this, and we've been hearing this narrative over and over again, is this idea that relative to, let's say, deaths by the flu, right?
Mm,
Or car accidents, things like that,
right.
that these cases are relatively low, at least in the United States. How do we, how do you respond to that? Because, if we're saying data is data, then how do we not address those numbers when we say, but this is different?
Yeah, I think it's important to look at who is giving you the information,
Okay.
and so if I want to know about the virus structure, I'm going to look for someone who's a virologist. If I want to know how this is going to impact the community, I want to listen to the best public health people out there. When I want policy, I want to go to people that I think are really smart in developing governmental policy, and so. I've a lot of the sub tweets and that. I mean, I use Twitter a lot for my news, but sub tweets have just really lost any value at all. In fact, I think the only thing they're good at for me is making me really frustrated and angry. And so I think being careful about getting too far into the weeds. And so if you use Facebook or if you use Twitter as kind of where I get my articles, you want to see who's talking. And so, who is this person? What do they do? Do they have expertise in this? A lot of people are overstating their expertise right now. For example, there was a video that got a lot of steam a couple of weeks ago, and the person who was like a HIV expert and was really not. And so I think those kind of things, as you look at it, take that extra step and really dig into like, who is this and what's their motivation. A lot of anecdotal, a lot of things are opinions. I think the other thing that's difficult is that in a situation like this where it really is an all hands on deck, you have a lot of people who are publishing their data results on studies very quickly. And the reason is because experts want to be able to get as much of what everybody else is working on as possible. But I think the media does us a pretty big disservice sometimes when they report, studies. And we all, 1 week, red wine is the thing that's going to save your life. The next thing, red wine is going to kill you. And so we
Please
all
don't
see,
tell me red wine's going to kill me.
right.
Please.
But it's like the bacon causes cancer, bacon's okay.
Right.
And so I think
And please don't tell me bacon causes cancer. I mean, this is where this. If anybody takes this out of context, we're going to see doom and gloom, right?
right, exactly. But I think kind of when so example the a lot of people were very excited about the information about Moderna is a company that makes vaccines, and so they released a preliminary study on their vaccine results, and everybody got really excited. It caused a huge uptick in the stock market, but that study is only looking at 45 people, and they only released the results of 9 of those people, and they didn't release the actual immune response that they generated or the ages of those individuals. So we see that like in younger people, it's pretty easy to stimulate a vaccine immune response that's preventative. In older people above, like with the chickenpox or the shingles vaccine, it's really hard to generate an immune response. So that's all information that's going to be really important for coronavirus vaccine, and the company isn't releasing any of that information. The typical procedure would be to release all of that data and let other scientists try to repeat it and dig into it and look for problems. Because right now, a lot of policy is dependent on, are we going to have a vaccine in 12 months, 18 months? Because then we just hunker down and try to make it until then. And I think a lot of people saw this and were very hopeful. But at best, this vaccine, even if it is a one that works well, and this specific type of vaccine, it has been tried a lot, and it's never this concept has not worked before with other viruses, and so that's why I was really excited that it possibly was working. But I think very very premature to get really excited about any of that vaccine data yet.
Yeah, and I was literally just about to ask you about vaccines because this is not a new discussion or debate, I'm sure, especially coming from a pediatrician's viewpoint, where you have people who are anti-vax during, normal times, we'll call them. What sort of confidence are you going to have as a physician, or must you have as a physician? Let's assume once a vaccine does come out, for you to be able to say to your patients, this is a must, right? Or this is something that we recommend.
Yeah. So transparency is really the key there. And so
Okay.
that's why it's so disappointing that this initial data was not transparent. Because, one, it's got to work. And then two, it's got to be safe. And so, so this initial data is a proof of concept. So this specific vaccine, what they do is they actually give you the messenger RNA. So they put the blueprint in you for the spike proteins on the coronavirus. Your own mucosal cells make antibodies, or they actually make the protein, and then your immune system makes antibodies to that protein, so that then you're protected. So if any coronavirus comes in your body, you're already ready to fight those spike proteins and get rid of the coronavirus. This technique has been tried before. It's never panned out as something that is effective. So everyone was very excited when they were able to prove in these 9 patients that there was some immune response. Next, you move to phase 2 trials, which means you give it to a lot of people, and you look for side effects, and you look for kind of cross reactions with different medications, and look across ages and races and other health problems to see if people can generate that same type of response. And then you go into phase 3 trials, which are huge studies that really dig into the safety profile. And so all of that takes a lot of time. And so to say, and then it has to be reviewed. So you don't want to go off, kind of with this premature um, product that hasn't been tested. And so I think, you're going to see, with pediatricians, we're used to really digging into this, and I think I don't want something that's rushed. I want something that we know, one, it works, and then two, is extremely safe.
All right, so I also want to kind of circle back to what we end up talking about every time we talk, because the information changes so quickly. But
Right.
is the best practices for us to keep ourselves, our families, and our neighbors safe, right? Wear a mask, yes.
Yes. Yeah. So
I want to make sure that's still
yeah.
the case.
Well, and I think kind of going back to, so Dr. Robert Pearl was he's the just retired as the CEO of Kaiser Permanente. He has a really good article in Forbes magazine today, kind of breaking down, the CDC did a huge dump on the kind of data across, like who's sick, and they really dug into the New York data. And then they're looking at some of the new areas where we see outbreak. I think the thing that's very interesting is we're clearly seeing two populations. And so as we look at, like, what do we need to do, there's two different populations. There's the over 65 group, where you look at the mortality rate is probably around 1.5, 1.3%. And then under 50, the mortality rate drops to 0.05%. Now, the mortality rate on the flu is 0.1%. And so it looks like, and that's everyone with the flu is at 0.1%. So what that means is that for every 1,000 people that get sick with the flu, one person dies. And so what we're seeing with this is for every 100 adults over the age of 65 who get sick with coronavirus, 1 to 2 of them die. And so we're seeing that it's really kind of coming out that probably about, coronavirus is probably 5 times more fatal than the flu, which is better than we thought. That's good news. I think the other thing that's really important as you look at the data right now is that the R naught, we've talked about that a little bit before. That means under normal socializing conditions, how many people would one person with the coronavirus infect? And the R naught is running about 3. And so we were able, with social distancing, to get that down around 1 to 1.4 in most communities. And so I think you look at the number, like what we've been able to do. The worry a month ago was that we were actually going to have people die in the United States of America in 2020 because they didn't have access to healthcare, because they were so swamped with these cases. And and it's really interesting when you go back and look at the timeline, it was actually Americans saying, like, I get it. And they did it on their own before, government actually started introducing. We saw in Tennessee that a lot of that started before Governor Lee shut things down. He was concerned because, in looking at cell phone data, he didn't feel like there was enough, social distancing. And so he put formal restrictions in place. Here locally, I think the school system shutting down as early as it did a ton to slow down the impact in Hamilton County. I think Superintendent Johnson and his leadership team are some of the heroes of our experience, in this initial wave in Hamilton County. And so the fact that, if you had said, kind of, we're going to have a virus that has an R naught of around 3, that has a fatality rate of probably, uh, of around 1%, you would have expected a lot more than 100,000 deaths. And so I think it's a tremendous, as a country, we should be really proud of ourselves in regards to, I think, everyone being concerned about everyone else, and doing the right things as we go forward. And so as you look at this difference, it's going to be really important, for those of us who are not in that over 65 age group, to protect that group. And what that means is all of us wearing face masks, all of us social distancing, all of us being really, really careful about hygiene. When you look at the hospital data, there's not as big as a shift. So about 40% of the hospitalized patients are in that over 65 group. And then when you look at 20 to 50, it's about 30%, and then 50 to 65 is about 30%. So we do see that folks under 65 are getting really, really sick and having weeks and weeks of lung problems and changing their heart function. And so I don't want anyone to think that I'm saying like it's just the over 65 age group that gets sick. There's plenty of people from 20 to 65 that are getting really, really sick with this. But I think it's imperative that as we kind of figure out how we're going to live life well, that each of us make a commitment to taking care of those in our community around us. So really be careful about masking, so we're not sharing. There's some interesting data that came out of the University of Iowa that is looking at face shields. So like plastic face shields
Yeah.
without face masking, and there's some evidence that those may be as effective as wearing a mask. They do have to cover your ears, so they have to kind of wrap around the side. And so I think, especially with sports, probably the NFL is going to drive the design of a lot of these, and we're going to see that, like in sports, folks are going to start wearing face shields to limit viral exchange while they're banging into each other. So I think that's going to be interesting to watch how that plays out. But like we talked about last week, really making sure that we're mitigating risk, and then realizing as we all talk about this that it's a different conversation for people over the age of 65. That the level of protection that folks over the age of 65 need to take is much, much higher. And especially as we look at trying to figure out how our children are going to go do things. So if a sixth grader is going to go to camp, and the camp is doing a lot to try to work with that. When they come back, we really need to give them 2 weeks before they're back around grandma or granddad, and being careful and thinking about what we're doing in regards to if grandma or granddad is important in our lives and we're having interactions with them without social distancing, then it's not a good idea to go out and take risks that aren't good for our grandparents and for those of us in our family that have people with chronic disease.
Yeah, Dr. Coffman, expand on that a little bit. You brought up the sports. I just saw the head of the National Hockey League who was interviewed this morning, and I know they've got a very drawn out multi-phase plan to bring back hockey, and how they're quarantining, et cetera. And Candy has now written on our Facebook page right now about whether baseball is safe. I know as we talk about summer camp, it goes hand in hand with sports, right? Our kids, they want to be active, they need to be active. Pools are starting to open, neighborhood pools and also community pools. Talk a little bit. I know we talk about this often, but what I haven't asked you is, what are the questions that we as parents need to ask? Like to say, it's fine for my kid to play baseball or soccer, right? Or it's fine to go to a pool as long as it's social distance. I like to know, like, what are the questions I should be asking before I engage, or my family, my kids and I engage in those things. Like I have a friend, I know, they're going to play soccer, but there's no carpooling allowed, right? And then when they play, they're going to be in boxes and certain things, right? Like it's one thing to say, yeah, it's fine for your kid to play. It's another to say, it's fine, but here are the guidelines. Have you seen anything that gives us sort of a handy tool to say, if these things are put into effect, this is probably the safest way that we can interact this summer when it comes to specifically the sports activities, and the pool?
So it's kind of three-dimensional. So
Okay.
it depends on kind of the environment that the kids are in regards to what's happening in that community. So if on some of these travel teams, if you're looking at, we're going to go play a team that's from a county where there's not much activity, that's going to be lower risk. They probably don't want to play us from Chattanooga because we're much higher risk. And I think you're going to see a lot of right now, it's not a good idea. TSSAA is really talking about this season locking down inner city travel, that teams will have to kind of figure out how to play local teams, or some of the county teams will be playing county teams where there's not a lot of activity. That you, as you, like we talked about last week, you really want to go from high risk things to low risk things.
Yeah.
So people being in the same space for extended periods of time, multiple groups. So like having the soccer team come, and there's 20 girls on the soccer team, and they're going to rotate through and do drills in close proximity, is higher risk. being able to separate them, so you have like 4 girls that work together all the time and they don't mix with the other girls on the team is lower risk. Everybody having their own ball, and so we're not sharing balls like in basketball. Everybody's going to be playing and touching the same ball. And then when you're not doing aerobic activity, to have a mask on, and so like sidelines and benches and that kind of stuff, to make sure that we're ensuring adequate distancing. Their frequent hand cleaning as we kind of come back to the bench, and then making sure that whatever you're doing for hydration, that you're not sharing that between, being really careful about sharing between players. And then I really do think, like the same group of 4 guys playing basketball on the street, and those guys are getting together every day and playing, that's lower risk. Going down to the park and those 4 guys playing, a bunch of other teams that are showing up at the park to play, that's a lot higher risk. So it's really going to be kind of how you're mixing. What you really want to do is the number of individuals that you're interacting with, expanding that slowly. And I think, with anything, like with the phone, you didn't just give your 11-year-old an iPhone and say, unlimited data, go enjoy it. Like we
Well, with
started.
our third born, we may have. I mean,
Yeah,
by that time, we were done.
But we started with a house flip phone, and make sure you're not going to lose it. And then we did the little talking with, and we texted grandma, and then we moved to kind of growing up, and then so there was a process with that. And I think you've got to take the same approach to these kind of things, where you have another family where they're practicing good hygiene and being careful, and their child is good friends with your child, having that interaction. Same thing with sports, that your child has a friend who they like to work out with, and so they're working out together and practicing and running together or whatever. And then we slowly build up. And I think that's going to be what people are trying to figure out, is like, how do we get in shape from nothing to kind of working toward a season that may or may not happen. And a lot of it depends on what we're seeing in the local communities. So as our numbers go up, the likelihood, if we're sitting right now at where 1 in 10 people are infected at any given time, it's hard. If you can't get 10 people together, it's hard to do a lot of team sports.
Yeah. In the pool,
so again,
can you get COVID? I mean, does
Not
chlorine
from
kill COVID? Like, that's the big question people ask.
It does. So it's not going to survive long in pool water. So I had a question yesterday, like my 2-year-old drinks the pool water and I can't stop him. And so is that dangerous? And you can get a lot of other things from drinking pool water, but coronavirus is probably not one of them. Now, kids yelling and screaming and spitting out water on each other and that kind of stuff, that increases the risk. So that kind of, close play amongst, where I go to the pool and there's 37-year-olds and they're all wrestling and jumping and screaming and, spitting out water on each other, and those kind of, like, that's not a good situation. And so, but going to a pool and picking a time where I don't think there's going to be many people there, social distancing on the sides of the pool. When you're touching common surfaces like rails to the diving board or getting out of the pool, make sure you're using hand sanitizer. And then, I try to make sure as you set that up, you really want to make sure we have control over who our children are going to be interacting with, and realizing, I have some kids that, to give them some discrete rules about this is how it's going to go, they can do it. And then other kids, no way. And so, and as you look at your children, that's how I would make those decisions.
Oh gosh, it's a lot. It really is. Of course, that is comforting to know that I still should be more worried about duty in the pool than coronavirus in the pool. So if I was savvy, I would have the Caddyshack, clip of the baby Ruth floating. So at least when we talk about, full circle nostalgia in the movies that I love.
Yes. To worry about duty in the pool again. That would be
Well, thank you, Dr. Coffman. And before we go, I wait for it to happen, but I'm so happy that Roger and Milbury are watching, who are your parents. And if I don't see it on there that they're watching us, I feel a little insecure that we aren't doing our job. So
hey, Mom and Dad,
to your parents, like you didn't know already, you have the most amazing son who is always so generous and graceful with his time. Before we go, I know we extended every time, but the consuming of information. Can you quickly give me, and hopefully others who are watching and listening, just a little guidance on how do we safely and sanely consume the information we need, besides this wonderful biweekly Dr. Calling Dr. Coffman, but in a way that isn't going to raise our anxiety levels, but will hopefully give us some comfort.
I think, this is not moving very quickly. And so, as we talk about, what are the things we need to know, you don't need a 24-hour news cycle to keep track of what's going on with coronavirus. I think at this point, Sundays and Wednesdays is plenty, to get some information on that. At least once a week, I think, kind of checking in that I'm going to go through and look at some places where I trust what's going on. I think, the Johns Hopkins website is a really good place to get some, if you want to totally nerd out and kind of dig into what's going on. I think New York Times has done some great work and kind of publishing that. Stanford is doing some really good work in trying to pull all that together. The San Francisco area, I think, is really leading on what is the public health response to that. So, as you kind of find, and what you're looking for is facts. So, what's working, what's not working. There's a lot going on that I think you're going to see the next couple of weeks around with folks who aren't symptomatic, are they contagious or not? And so there's some data that's coming out of all of South Korea's work of their tracking that's showing that people who don't have symptoms probably aren't that contagious. There's some work that's been done in the United States looking at some of our institutional settings like jails and nursing homes that shows that 50% of the people that are asymptomatic may be shedding virus. And so that's going to determine what this fall and winter look like in regards to what is that, and that's going to be something that continues to develop. I think if you find yourself getting nervous, frustrated, wanting to make big changes in your investment portfolios or your friend group, it's time to step away and just take a moment. And then I think coming back, like we always talk about, just take care of yourself. Make sure you get plenty of sleep. If you can't sleep, get some help. Talk to good friends, run it up the ladder, counselor or your internist or whoever, pastor, and I think make sure that you're reaching out to the people that you depend on. I've tried to be very verbal with those folks and say, look, I'm counting on you. I need your help right now, and making sure that we're all prioritizing those kind of interactions, and then looking for those folks that are isolated around us who are struggling, and being purposeful about finding creative ways to reach out and just because we all need friends right now. We need family, and I think we're all trying to figure out how to do that safely, and realize even that takes energy and it's stressful. So even the things that we need and love take work to do. And I'm just so grateful for you, Allison. You've been a big encouragement to me, and I'm just so grateful we have this time to talk.
Well, me too. And look, I think I told you that, sort of in quarantine, everybody's joking that it's not the freshman 15, it's the COVID-19. And, we're drinking, we're eating. I realized that after doing that for 9 weeks, yesterday, I sort of said, I'm going back to like a regiment. Right. And frankly, it actually gave me some peace of mind. Right. It's back to, we may not be able to control what's around us, but we can control how we react to it. So I'm still having maybe that glass of wine or so every night, but during the day, I started yesterday. So it's gone so far for 24 hours. So far, the spinach and chicken has been an excellent, replacement to the chips and dip. But it's back to, for someone like me, and I know many people who have lost control over so many things in their life, to be able to take control in a healthy way of certain decisions, I think has brought me back to sort of this reality of adjusting to this new normal, but also, not just counting my blessings, which we do every day, but finding grace and gratitude at every turn. And that goes to say with our children, with our neighbors, with our friends, with the people around us we don't know, and especially with ourselves. And with that, Dr. Coffman, I so appreciate you, and I always appreciate you taking my call.
Same to you, Allison. It's great talking to you again.
You too, and I'll see you on Sunday.
All right, on Sunday.
All right, thanks so much.